Okay, Rhoda, is there any time in your learning about diabetes that there was ever a point where you thought, crumbs, if I changes some sort of part of my lifestyle, that it might influence the way you deal with your diabetes?
Yes, by not eating too much sweet stuff.
Right.
Which isn't necessary really for anyone to really eat. And it was when I saw someone that was ill, what started as a tiny, I realise now how important it is to go and have your feet looked at and tested, because the person I saw, it was like a little pinhead,
right,
just on the toe, nothing you would have thought, but by going.
What was it, an infection?
No, it's just like a little tiny black mark.
Right.
And when she went, he said to her, I want you to go back to your doctor.
Mm-hmm.
And then she went to the hospital, and unfortunately, if she'd have looked after her feet a bit more, and maybe she didn't really bother, she kept eating sweet stuff.
Yeah.
And it ended up her big large toe coming off. They tried everything imaginable, but then she ended up having to have her leg amputated to the knee off, because they just couldn't save it.
And how did that kind of make you feel about your diabetes? How did that affect you?
Well, then it made me realise that I should try it and follow, a proper diet and things, and there's plenty of helpful books out there.
Yeah, because when these sort of things that happen, they're very far and few between. Were you frightened that it was going to happen to you?
No, I just hoped it wouldn't happen.
Yeah.
But I suppose at the back of my mind it was there, that it could,
and
if I didn't look after them.
Helped you to eat a better diet,
yes.
Have a better lifestyle?
Yes,
sort of
it
thing?
did. Made me eat the things, and there were certain foods I had no idea that were really high in sugar, like certain fruits. So,
and how did you learn about
well, when I came, I was lucky. I went to see a dietitian, and she told me things, but I had no idea, and like bananas are quite high in sugar, so I only buy smaller things.
Absolutely.
And I find if you tell yourself you can't have something, the more you want. But if you don't eat too much of something, then it doesn't give you quite such a big sugar,
a sugar rush. Yeah.
Yes.
Do you think it's the education? Do you think if we could put posters up, if there was more information available, would that help you with your diabetic care?
Well, it might for some, but I might notice a poster up, but I have to admit I had leaflets and stuff on it that was sent to me, but I'm a bit lazy at times. I don't always read things.
We don't, do we? We lead busy, brimming lives.
Never got time.
Absolutely, absolutely.
Whereas it would be important. I realise that now, it's important to read it all.
Absolutely, yeah.